For the AP projection of the acromioclavicular joints, or the AC joints, it is common to use a 72-inch SID. The longer SID reduces magnification, which also enables both joints to be included in one image. Furthermore, it reduces the distortion of the joint spaces resulting from central ray divergence. For this position, place the patient upright, because dislocation of the AC joints tends to reduce itself when laying down. Also, adjust the height of the IR so the midpoint of the IR is at the same level of the AC joints. You want to center the midline of the body to the midline of the grid. In order to avoid rotation, ensure that the weight of the body is equally distributed on the feet. With the patient's arms hanging at their sides, adjust the shoulders to lie in the same horizontal plane. It is important that the arms hang unsupported. For the AC joints, you'll be making two exposures, one in which the patient is standing upright without weights, and a second which the patient has equal weights, usually 5 to 10 pounds, affixed to the wrist. After the first exposure, slowly affix the weights to the patient's wrist using a band or a strap. Instruct the patient to not favor or tense up the injured shoulder. It is very important to avoid having the patient hold the weights in each hand. Holding the weights in each hand tends to make the shoulder muscles contract, reducing the possibility of showing a small AC separation. For shielding, of course you shield the gonads, but also be sure to use a thyroid collar because the thyroid gland is exposed to the primary beam. For this, you'll want to suspend respiration. You may notice that the central ray is directed perpendicular to the midline of the body at the level of the AC joints. The following two images, they demonstrate how the weights should be affixed to the wrist, and also you can see the arrow indicating an AC joint separation. When reviewing your image, be sure to make sure there is no rotation or leaning by the patient. Always there should be a right and a left marker, also a marker indicating the images with weights and the images without weights. In this particular image, neither right or left markers are included, nor are weights or without weights marked on the film, which is incorrect.